The first couple of weeks after having my child were amazing. And then what started happening was, as I started feeling really isolated, I felt like I didn't have any support.
I went to the grocery store and I was buying cereal and I was standing in the cereal aisle and I just broke down crying because there was so many choices of cereal to buy. I couldn't pick one.
I started to feel more tired and more sad. And I didn't want to talk to my doctor because I don't want them to think that I was crazy. And I don't want them to feel afraid or remove my children from me.
I was pregnant with twins and one passed away at the birth. And the other one wound up going to UCSF for meconium aspirated pneumonia and was intubated and on an incubator for the first week of his life.
1 in 8 women will experience some form of postpartum mood disorder, or PPMD, so it can hardly be classified as rare. And yet many women struggle silently. They may have heard of baby blues or postpartum depression, but be experiencing completely different symptoms that are not commonly associated with depression or the birth of a baby. Women of every culture, age, income level, and race can be affected.
As a physician, I try to encourage moms and their families to watch for warning signs of a mood disorder during pregnancy or postpartum. Often, the mom herself may not even notice these symptoms, so watching for the warning signs would be important. Increased anxiety, increased worry, depression, crying all the time, sometimes thinking, obsessing about things, random thoughts of obsessing. Those are all signs of a mood disorder.
Some women also experience sleeping too much or too little, a loss of interest or pleasure in life, a decrease in energy level, feelings of hopelessness, difficulty making decisions, trouble focusing, withdrawing from friends and family, an overwhelming sense of shame. If you're having any of these symptoms or have thoughts of harming yourself or your baby, you may be suffering from a perinatal mood disorder.
Some of the risk factors for perinatal mood disorders are a previous or current depression or other mental health diagnoses, a history of trauma or abuse, or any current trauma or abuse that's going on. Also, previous infertility or miscarriages or loss of an infant can make it very difficult time. The death of someone that you are close to in your family over the past year can make you more vulnerable. Lack of support from your family or your friends, or social isolation. If you're not connected or you feel pretty alone and don't have people you trust to talk to, that can make it difficult to get through this period of time without some help. Lack of stability in your relationship with your partner can also add to the risk. Sleep deprivation is a really big one, and it's really important to get 5 hours of uninterrupted sleep. And if you have a difficult or complicated delivery, or the delivery doesn't go as you planned it to, can increase your risk, and also any medical complications of your infant can also make it difficult.
Other risk factors include substance or alcohol abuse, poverty, family or personal history of a mood disorder or anxiety, a history of PMS, an unplanned or unwanted pregnancy.
I was going to this mom's group, and everybody at the mom's group seemed to be happy, and everybody was having such a great time. And I was telling them, I was like, I feel a little bit strange, and I'm having these different thoughts. Like, I kept thinking it would be best to just give my child to someone who could love them better, because that way they would be okay. And I really just wanted my baby to be okay. But I go to these groups, and these women were just so grateful, and I felt even more, like there was something, there had to be something wrong with me, and I just really couldn't identify what that was.
Every time I was looking at my baby, I thought, oh, I'm crazy. Why I'm having those thoughts? So it was like changing moves and changing thoughts. And I was afraid to have a scary thoughts.
Approximately 80% of women experience an emotional letdown or baby blues after giving birth. This can occur within the first week and can last for 2 to 3 weeks. Symptoms that last for more than 3 weeks or that interfere with your daily life could indicate a perinatal mood disorder. 15 to 20% of women might experience depression and or anxiety, 10% panic, 3 to 5% obsessive-compulsive tendencies, and 1 to 6% might experience post-traumatic stress. The most feared, yet least common of the perinatal mood disorders is postpartum psychosis, which only affects 1 to 2 women per 1,000.
I got in a fight with my sister actually about no one being able to watch my babies, and I actually called the pediatrician to see if I could take my baby to the Dixie Chicks concert because I couldn't leave her. I mean, that was another thing that the depression did for me. It was like I couldn't leave my baby with anybody. Nobody could take care of my baby but me.
Another common diagnosis is postpartum obsessive compulsive disorder, or any slew of anxiety disorders, and often with that comes distressing thoughts or images in your head of hurting your baby or hurting yourself, and that can be really, really scary. And moms who have those thoughts and feelings aren't going to hurt their baby. And they will go to a lot of trouble to avoid, any kind of risk of hurting their baby. And it's very treatable.
I was crying most of the time. I didn't feel like happy. I didn't feel any reason to feel happy. And the worst thing was that I was not able to fall asleep. And I was getting worse and worse and worse every single day.
Sleep is a really, really important piece of the whole puzzle, and I think that it can be very difficult to get uninterrupted sleep after you have a baby, and so sometimes I think it really helps to make plans for that, and have you may get your partner or somebody else to come in and take care of the baby so that you can get 5 hours at least of uninterrupted sleep.
I didn't have any energy. I don't have energy to play with my older children. I was cooking just because I have to do it, but not the way I love to do it for my family. And I didn't want to go out. I wanted to be just in my home inside. I didn't want to talk to anybody. I wanted just to be in my room.
Even though I had people cooking for me every day for almost 6 weeks, there was a perceived lack of support, and that I just felt like no matter what I did, people were judging me, and it was always wrong. And they all had their advice, and they all had their input and all that stuff. And so that just made me feel worse about myself, and I just went more inside myself.
When I'm assessing and looking for indicators that a woman either has depression or anxiety, I want to know whether it's interfering with her functioning. Is she able to take care of herself? After the baby's born, is she able to take care of her baby? And does she feel like she wants to get up out of bed in the morning and move along with her day?
I suffered from the depression for close to a year before it was diagnosed.
And I didn't know about postpartum depression. That wasn't even in my vocabulary. I thought that it had to be something with me, that I was somehow defective as a mother, and my mom died when I was young, so I didn't have that kind of person to look to get any kind of support. So that was very challenging.
I didn't never hear anything about it, having this problem after birth.
I'm not exactly sure what contributed to my postpartum depression. Like I said, I didn't even know that it existed, and what happened was a couple of months into it, my husband was like, "There's something wrong with you."
I was just getting desperate, and what I did was went on the computer and just started trying to look around to see what was going on, and I just happened on a questionnaire that had to do with precursors to postpartum depression, and it was amazing when I read that. It was like this huge relief on the one hand, because I could say, this is it, aha, you know, we found what's wrong here. But on the other hand, I was kind of angry because Kim had had so many of the precursors that, like, I was kind of angry at the doctors that they didn't pre-diagnose her, you know, say this might be a problem. I mean, we had no warning at all, and we suffered for quite a long time before we got into the solution. So I think information, education, you know, something that how common this is. People don't want to talk about it. People think you're supposed to be so happy when you have your baby, but overwhelmingly, a lot of people aren't.
Mm-hmm.
And that's normal.
You know, there's a lot of shame built in around, you know, having troubles emotionally. And a lot of moms also feel like that this should be a time that they're joyous and happy and excited. And a lot of times moms will feel ashamed when they're not feeling, you know, really happy and excited. And you can have both. You can feel very happy about this and elated, but also exhausted and scared and sad and overwhelmed. And we don't talk about those things very often. And I think that even though, you know, a mom may have support and friends and family around her, she may not feel comfortable opening up about those feelings or thoughts that she's having if they're negative about being a mom or about her baby.
I didn't talk to anybody, not even my family, because I don't want them to think that I was crazy. And I didn't know that it was normal to have those feelings. And I was angry all the time. I had an older children then, and I didn't have any patience. I didn't feel any love, and that was very scary.
I wasn't able to be there for my older children. They were just kind of left in limbo while I was trying to deal with being depressed and taking care of a newborn. I think it affected them in that they didn't have a mom who was able to cope with them for a little while. At the time, I had a partner, but he was gone all the time working. So I was home alone with the newborn and 2 other kids to take care of.
We've had a very kind of harsh transition over the last 150 years with contact. Some areas, some families, some people have been able to keep those systems in place or find a way to honor those systems still. Other people struggle with it, usually at a fault it's not their own, but maybe they don't have support systems in place. Maybe different things have come into their life that have, you know, pushed them further away from family or from their tribal areas. So it's not in place anymore, but I think it's okay to recreate those things in a way, to find ways to recreate those things today that work for women is probably what's most important. So it doesn't have to necessarily be your auntie and your grandma and your sister anymore, but maybe it's a good friend, a sister-in-law, you know, or your spouse, and finding ways to ask for help from them so you can make that transition. Still honors the tradition and culture that we had.
A lot of times it's the partner who will come to us and expressing concern that the mother may be depressed or is having anxiety or stress. I think sometimes we don't notice when those things are happening within ourselves as fast as the people around us, other family members, may notice.
Kim was open enough to me to kind of, I can read her a little bit, and I could tell that she wasn't experiencing what was happening. You know, that's why I knew something was wrong. It was not that there was something wrong with her, but it was that these people were trying to be supportive. I was trying to be supportive, and she was feeling like we were putting her down and acting like we were putting her down. And so, you know, and feeling like she didn't have people. There was tons of people. We had a bunch of friends who wanted to help. So it's, you know, it's not logical or reasonable. It's depression.
It's not easy because you start to have problems with your partner because you are not there. You are there, but you need everything, and you are not there to give. And sometimes the family members are not ready for that.
We're very highly functioning. Our family works really well, but I mean, there's a wake left. You know, it's not like it just disappears one day. You know, what is that saying about you can't put the toothpaste back in the tube kind of thing? You know, so it would be good. It would be good to find out about it before you have it, you know, if you're pregnant?
He was always there to listen to me, but I noticed that he was getting tired. He was probably also suffering depression.
I finally started seeing a counselor, and it was during like my third session with the counselor that she said, "You're suffering from a depression." I felt like a weight was lifted off my head, that there was finally a name for what was wrong with me. I had someone I could talk to about what was going on in my life, and finally I could just cry and not be embarrassed about crying in front of people, because the therapist is used to people breaking down in their office.
During my pregnancy, I also had two friends. I prepared them to be ready for me, so they were calling me all the time after I had my baby. I was, again, not able to fall asleep, and I knew that that was going to increase my depression. So I went to my midwife, and I was afraid to have medication because I was pregnant. And it was okay to take medication.
When the antidepressants took effect, it was like night and day. All of a sudden, I could sleep. I wasn't as tired as I was. I was able to cope a lot better. I was able to take care of my kids better.
Typically, medications are prescribed for about a year. They say that you need about a year for them to really do a good job at what they're doing, and that you don't have to take them forever.
I think of it as a circle or like a wheel. There's all these spokes. Medications is one of them, nutrition, exercise, sleep, and then support. And they're all extremely important. Support meaning, does she have support from her family? I like to make sure that women have support from other women, other moms that are going through similar situations with their pregnancy, birth, postpartum, or have had similar situations. I think having that support network is really essential. In terms of pharmaceuticals, to me, when a pharmaceutical is working ideally, it means that it helps the woman to get to a place in her daily life where she has, I think of it as having the oomph and the wherewithal to be able to integrate those things that she knows are going to make her feel better. A lot of women know that they need to eat well, they need to get more sleep, they need to exercise, they need to reach out to other people. But a lot of times with depression and anxiety, you feel so down, so stressed, so maybe weird and isolated that you're not able to take advantage of those tools that you know that are there.
He wanted me to go to the doctor. I didn't need to go to the doctor, but I kind of went just to get him to, back off. And the doctor decided that I had postpartum depression and prescribed medication for me, which I went and purchased. But I was very concerned about breast milk and the medication, and so I didn't take any. And I think that was a big turning point for me, because I made a decision that day to try and do something different. I started increasing my walking. I started trying to get more rest.
Many moms don't want to take medication for various reasons, and there are a lot of other things that you can do, adjunctive therapies, and I think the best thing to do is to do a combination of things and that's suited to you, and stay open with your doctor about talking about what you're doing. There are other modalities that are really worth trying if medications are definitely not something that you want to do. Things like herbal remedies that you can talk with your doctor about, homeopathy, acupuncture has been helpful for many women, counseling and psychotherapy, and support groups are also very good. Massage is very good. Getting time to take care of yourself and nurture and heal yourself through through the hardness of this time.
What I did take advice from the doctors, I did go seek counseling, and I went to go see a woman, and I saw her for a while. That was really helpful to have somebody that I could talk to and tell the truth, who didn't judge me, and I could tell her, like, I really feel like my baby would be better off with somebody else who could love her more, because I don't think I'm doing it right, and she would listen to me without judgment, and that was really helpful. There were just so many things that it was just nice to finally be able to let all that kind of out and go. Some of the things that I did to help me get through this is that I walked. I walked and I walked. I would put those kids in the stroller or wear them and walk. In fact, I'm on the Transportation Safety Commission now because I think I walked so much and saw so many concerns. The other thing that I really found helpful was drinking water, meditating, being able to sit for a couple of minutes, which is not easy. The bathtub is my office, and just laying in there and shutting the door. Being willing and finding someone that I could tell the truth to was huge. Just because I could tell her everything and know that it was going to stay with her and that I wasn't being judged for that. That was huge. Talking about it took a lot of the power out of it. Eating better food, funny movies, tea. For me, there was a spiritual solution, and that was taking care of my whole body. And I've continued to do that. And that's the neat thing about this experience, is that I wouldn't trade it. Though it was horrible and I didn't enjoy it, I learned a lot of life skills that today benefit my life. I run now. I take care of my physical self and my spiritual self now, and still practice those things.
Talk to your doctor if you've had any depression in your history or trauma or any other mental health diagnosis, and so that you can plan ahead for those things and your doctor can help you figure out what to do. You may want to find a therapist if you don't have one already, and establish a connection with one that you feel would be, that listens to you well and that you feel safe and comfortable with. And you can make a plan with that therapist on how to best cope with the things that are hard for you in your life in the present, and then they can be there for you if things get tougher.
If I feel that I don't want to go out of my room, I need to go out. And if I feel like I don't want to eat, I need to eat something healthy. And if I feel like I don't want to talk to anybody, even that I don't want to, I will answer the phone and I will call my friend.
I would ask family members to watch out for all of these symptoms that could be happening, and to provide support to mom. Of course, helping them to not overdo it is critical. But watching for the warning signs, talking to them about it, and coming with them to see the provider to discuss it even further is really important. I've had a patient that came in with her whole family, sisters, mother, to talk about it because she didn't really want to talk about it. And they're the ones that brought it up. And I would have never known that there was a problem if they had not brought it up.
If I had a friend who, it looked like they were experiencing something similar to what we went through, I would tell them about it. I would tell them, education's the thing. I think that's what we were blindsided. We didn't see this coming, and we didn't know anything about it. Mm-hmm. And just knowing something about it helps you deal with it. And so I would tell them, this is what it's like. I would share my experience, and I would say you can get through this, and it's difficult, but it's not that uncommon, and there are resources to help you out.
From my experience, people all the time just told me, get over it, get out of it, and it's not that easy. It doesn't happen that way. It takes some help sometimes, whether it's going to a counselor or getting on antidepressants. But there is a light at the end of the tunnel, regardless of how you decide to get out of it.
The best thing that you can do for your marriage, for your children, for all that, is to take care of yourself. Like I had a real problem, like I said, of trying to fix everything and being the solution all the time, and that probably is what helped my mood go really far south. And that's what got Kim out of the depression, was taking care of herself. And you know, that's like the most generous thing you can do for anybody, is take care of yourself.
Yeah, and for the marriage, I would just say don't quit, don't give up. You'll get through it. It's hard. It's really hard, but you can get through it. We have.
In a lot of ways, it bonds you too. You know, it's a trial by fire kind of. So.
Hugely.
Yeah.
A long time ago, when a new baby came into the world, the family embraced that baby. The mom, the grandmother, the aunties, the great aunties, the cousins, all helped raise that child. Now, oftentimes, it's just the mom. So we feel like we should be able to do that on our own, and some people can. But traditionally, it took a lot of women to take care of a child and to take care of the mom. So it's okay to be able to ask for help. It's okay to let people know that you need help. And it's okay to tell people that, you know, I'm not feeling quite as celebratory as that, you know, I don't want to celebrate as like everyone thinks that I should, and that's okay. It's important to really take care of babies, but it's also really important to take care of our moms.